Just in case he gets into respiratory distress. My kit, my saline, my mask I still have. I've got my hand sanitizer, cleaning that. I'm gonna put on clean gloves. Because first thing I want to do is a site inspection. I'm gonna remove this. Remember we had that gauze here. I already took it off. Remove the gauze. And then when you're looking up underneath here, you're looking for redness, you're looking for oozing, signs of infection, any any mucus, any bleeding, anything on there for your site assessment. So that's all fine. I'm done with these gloves now. Here we go. Again, sterile procedure. Check your package, check the expiration date, make sure everything's good to go. Take this off. Get this opened and ready. Put it on my face. Sterile. Again, this is a sterile procedure. Me fixing this, but I'm fixing it this way. I don't want to pull that down. But it's this, I can't do anything about that. God. You're supplied with 2 sterile drapes. You're sterile, they're sterile. Put the shiny side down that way in case you spill on it. The spill will be absorbed. Put one there. And I'll put one on a patient. Shiny side. Just to give you more of a sterile range here. The inside of this stuff comes out here, gets separated. That's my split gauze. I should have at least 2 or 3 of these. I'm just gonna get them folded up and ready to be used. Watching my 1-inch border, making sure my supplies don't go near that edge. I need these to pull the ties through. I need this for scrubbing, so I'm going to put it in the scrubbing chamber. These are also used for scrubbing in case I got a really cruddy like intercannula, so I'll put them in the scrubbing chamber. These here are going to be used to clean the outside of the tray, so I'll put them in here where the saline's going to go. Alright, these are my ties here, so it looks like I'm ready. So now I have to commit. I'm going to go ahead and commit this hand. I'm going to pour off, if this is an open container, hopefully it's within 24 hours. So it's not good after 24 hours. If you opened it up, dated and time it, for when you open it. If it's already open, just pour off like the first couple of mLs, just to get any bacteria that might have been sitting on the rim. Just pour off like 10 mLs. Then go ahead on and pour this into your chambers. And you see me going around my field, right? Don't go cross over your field. Because again, that's a violation. If anything drops on here, you contaminate your fill from going around. So you always got to have your table positioned to where it works best for you. Okay?
Are you pouring it in all 3 chambers?
All 3 chambers. Now, in some institutions, we'll put peroxide in the biggest one, or even a saline peroxide mix. So you go with the policy of the institution you're working with. But I believe on your rubric, they might have taken peroxide out. If it's still in, the peroxide is going to go in that big one. Either way, you won't fail with us, whichever you put in there. So all that's paperwork is ready to go. This was my hand, so this is a dirty hand. I remember which hand is dirty. This one is my sterile hand. I actually need this closer to me. So the only part I can touch of this that's going to make sense is going to be this, which is clean hand, right? So I need to sit it right here. Does that make any sense? I don't want to sit it on like that. I want it close to me when I go to pull out my trach. I don't need to reach and get that stuff right now. Now, I'm ready to get my inner cannula. This particular mannequin, this is a disposable inner cannula. And the way I know that it is because it's clear. If it was non-disposable, it would be white exactly like the trach. And it would have a dot, 2 dots on the side, and you turn the dots and match the dots up, and that's how it locks in place. But with this being a disposable one, it has 2 clamps or flanges on the edge. You gotta pinch these and pull it out to release the clamp that's up underneath here. You have to pinch and pull. Thanks. And of course, it's not gonna be this hard to get out. All right, but see, I got it. But see where I'm holding it? Understand that this part is sterile. You can't touch it with this dirty hand. So do not do this. All right? You're going to bring it out. You're going to keep your hands focused on this. You're going to come over here to your cleaning chamber. Reach in here because this hand is sterile. All this stuff is sterile. Sit this in the peroxide, but don't do that. Now you've contaminated your solution. Because remember, the top part of this was dirty. Hold on to it. Scrub it back and forth, back and forth. Right. And then if you have to, here, this goes in the trash. Then you have these extras if you need to get into more detail. If you have to, you got 3 of them. So they're all used. Now, that's done. You can take this and put it in one of your salings. Just rinse the saline through. And then tap it to the side to get all the moisture out. Now go to put it back in. And when I put it back in, imagine yourself a clock. 5, 12, 3, 6, 9, 9 o'clock. So I'm going to put it in at the 9 o'clock position. All right? 9, and turn it to 6, and it slides right in. And then you got to pinch to get this to clamp, and it's back. Now, at this point, technically, the sterile procedure is over. But you can still, maintain sterile practice. But once that goes back in, you don't have to be too, anal about it. You can take these, use the saline that you didn't use, dip in the fresh saline, and now you, 1 wipe, trash. Dip in the saline, go up underneath here, 1 wipe, cross, trash, and then you can use this one to pat dry. Change the side cloth and to pat dry. And then if you need these, you can get in the little crevices if necessary. So this is to be done every shift. Trach care is shared responsibility between nurses and respiratory therapists. Clean it up, clean it up. And that's all looking good. Use this if you have to. Now at this point, we want to put on a new set of trach ties. The ties that come in your kit won't be long enough. Let me see the difference between these 2 ties. In checkout, you'll have one. Then you'll have this replacement one, because this one won't work. Okay? So we'll provide you with this. What you want to do is go ahead and push these up top to get them out your way. We'll tie it on because you want to utilize this area. And you see how rubbery this flange is. This part is harder, doesn't bend like that, but this bends so that you can bend up and stick stuff in it. All right, so move them up there. Do not remove the old trach tie till you have the new one in place. Take this and kind of go like 2/3 on a fold. This is where these will come into play if you need them. You can start from this side. I would take this tip and kind of fold it again so that I could get it up underneath here and pull it through. See that? Mm-hmm. Now I got a loop. See it? Take this whole unit and pull it through the loop. Got it? Just here. Get you up. Now I'm on this side. I only need one of these right this second. I'm gonna take this and pull it again so I can get it easily. Pull it through. Now this, see my other end? This is where I'm gonna make my knot. And you wanna make a real knot, but you're gonna make sure you can get 2 finger breaths up underneath it, because you don't want to be too tight. You cause skin damage. Make yourself a real knot. Not one of those slip knots, because you know what you don't want is a slip knot and it gets caught in the gown and somebody pulls the gown off. And now the slip knot comes loose. Now nobody knows the trach is loose. Right? So now I'm ready to take the old tie off because the new one's in place. Now I can put my split cords back underneath him.